podcast where we talk about GI topics and do a deep dive on questions you guys have. I want to thank you for joining me today. If you're new to this show, I do a podcast where I go into a deep dive on certain GI topics. And then if you're watching me live on my social media streams, I answer your questions you guys have on anything going on when it comes to your gut health. Who am I? I am a board certified gastroenterologist trained at the Mayo Clinic. I've had 10 years of experience. I've treated thousands of patients. I've cured thousands of patients. I publish papers, and currently I work in my own practice at Lubbock Gastroenterology. If you're in this area, come see us. We can do and find out exactly what is going on. So the way this format works on this podcast, we do a deep dive in the first half, and towards the second half, answer questions you guys have given me in my audience, either through my live stream or on my social media pages as well. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Give us a 5-star review. And if you're watching this live, let me know if you're watching this live on the replay. And also let me know where you guys are watching this at as well. All right, we have a great show today. We're going to do a deep dive on a topic that I see a lot about, which is inflammation. What is going on there? In addition, we're going to talk about other things as well when it comes to inflammation. We'll discuss diarrhea, what are some causes of this, and some things you can do to work out for this as well. We'll discuss other topics you guys have on the deep dive and the live stream as well. So I'm excited about this topic today. So before we begin, let me know if you have any questions down below. A couple of housekeeping things. Number one, we have changed the time for our live show back to 7:30. So let me know if you guys like this time or not. Number two, we're putting out a survey out there about patients to see what topics you guys want. And so I would love to hear what you guys would want me to talk about. Other videos want me to talk about, other deep dives. I'd love to hear about that as well. And then number three, obviously, if you have any GI issues and you're in this area, the best way to get a hold of us is to come see us, Lubbock Gastro, or subscribe to my newsletter, which we'll put a link down below, and which you can get information, answer questions for me, and also get my newsletter, my topics that I talk about every single week. All right, let's go to the first topic, inflammation. So what exactly is inflammation? So inflammation is your body's natural response to an infection or an intruder going on inside your body. So when you cut yourself and you develop a scab, that is the inflammatory response of your body trying to heal itself from that insult. When you get an infection and you get a fever, that's also your body's response to attack that particular foreign body. It's the same thing when it comes to your body and your gut. If you ingest something that is not good for your gut, or your body doesn't have a response to this, it's going to manifest that as some sort of inflammation going on inside your body. Now, different people can have different measures of inflammation depending on so many different factors: stress, environment, genetic predisposition, allergies or intolerances. And so it can be a wide spectrum of ways that your body can respond. And some people don't even have an inflammatory response because they don't have some of those predisposing conditions, including the gut microbiome, that make it more likely for you to develop some sort of inflammatory response. So let's talk about some of the more dietary things when it comes to inflammation. Your diet absolutely plays a significant role when it comes to inflammation. Have you ever noticed that if you eat certain foods, you're like, I feel terrible, I feel bad, what is going on? That is true. That happens to me quite often. If I have certain carbohydrates, I know that I feel sluggish and I feel tired. And don't get me started if I have milk, because my milk, it is terrible when I have that inflammatory response. It is not fun. And that inflammatory response is me manifesting what's called lactose intolerance. So diet plays a significant role when it comes to managing inflammation, but also introducing inflammatory components into your body. I have a lot of my patients who come see me, hey, Dr. Islam, I think I'm allergic to gluten. That actually may be the case. That's actually your body's reaction to eating a substance that may not sit the right way for you. Same thing with certain foods that are called high FODMAPs. FODMAP foods are certain starches and carbohydrates that are known to cause an inflammatory response like bloating, distension, diarrhea in a lot of our patients. And sometimes ingesting those particular carbohydrates can make you feel like you're inflamed all the time and not doing good. So if you're wondering if you have inflammation or what is going on, what do I do as a doctor to help kind of piece together what is going on. So first thing, I typically will get some labs. We may get some basic labs. We'll check your blood count. We may check some inflammatory markers. I may check some stool testing to see if there's any evidence of inflammation going on inside that. Now, I may do some imaging. I may do some procedures. This will give me more of a visualization of what is going on. But because inflammation is such a new process in the medical field, it is hard for us to give you a definitive diagnosis of what is going on or what are some of the reasons why you may be feeling inflamed. So how do you know even if you are feeling inflamed? Well, the best way I know from a GI perspective is that certain foods make you feel just inflamed. It doesn't make you feel good. So for example, you eat certain foods, obviously you feel like you have brain fog, you have joint issues, you have skin issues, you don't feel very good. That may be your body's response to inflammation. So my example, once again, when I have dairy, my body's response is to produce so much gas and dissension. I know TMI, but I'm here to sacrifice for you guys. But this is my body's response when it comes to inflammation. And your response may be different as well, but you should notice certain patterns of certain foods that can make it more inflammatory in your body. And you know that if you minimize those foods, that inflammatory response goes down and you don't feel as bad as you did before. Now, we do know that overall, in terms of health, we want to try to optimize as much as we can the anti-inflammatory foods and try to minimize as much as we can the foods that produce inflammation. So there are 5 foods that I recommend that if you're worried about inflammation, you start to incorporate into your diet to decrease your risk for developing inflammation. The first one is fatty fish. Fatty fishes have omega-3 and omega-6 fatty acids, which are antioxidants, which have been shown to decrease and minimize inflammation that's going on. This is one thing we recommend. Number 2 is fiber supplementation. Fiber supplements have been shown in clinical trials to decrease inflammation as well. And so adding fiber, whether it's vegetables, fruits, or whether it's even supplemental fiber, has been shown to help out in clinical trials when it comes to inflammation. Having berries, especially blueberries, strawberries, and blackberries, are high in antioxidants. This can also decrease the amount of inflammation going on inside your body as well. Things like leafy green vegetables, nature's fiber. These are ways to destroy the inflammation going on in your body. It can change your gut microbiome, can make you feel better, and also change the makeup of the inflammation going on. And then lastly, nuts. So things like walnuts. These types of nuts have been shown to decrease inflammation in your body. So when somebody's feeling like they're inflamed or they're feeling things are not working correctly, start incorporating these foods will allow you to help you manage the inflammation and get that taken care of you. But just like there are foods that can fight inflammation, there are also foods that can make inflammation worse. I know you know what they are because they're pretty obvious. We'll go through them. So one of the foods that we know that can make inflammation worse are processed foods and refined sugars. These are foods that are fast foods, extra sugars, high fructose corn syrup, soft drinks, fries. These are not good for you. They're processed and they're full of sugar. And just that name in and of itself should make it more likely for you to not want to have these particular foods. Number 2 are trans fats. These are not healthy fats. In fact, these are the fats that have been shown to increase your risk of developing colon polyps, colon cancer, IBS, reflux, heart disease, stroke, Alzheimer's, all sorts of bad conditions. Number 3, processed meats and red meats. These are things like beef and pork. I know people love their steak. Listen, I'm from Texas. I know this. But we do know that red meat is a trigger for inflammation. And we do know that the more red meat that you have, the worse it's going to be for your body as well. Number 4, fried foods. I mean, come on. I know fried foods taste great. I love Popeyes, but I also know it's terrible for me and it's terrible for you. There's nothing good in them. They have the trans fats, they have the artificial sugars, and they don't even have the right chicken. The chicken, I'm sure, is not real. So having that particular food is not going to be good for you. And then lastly, we also know that certain drinks like full can sodas, that are regular sodas, these things are full of sugars, empty calories, and also a lot of inflammatory substances that are there as well. So my recommendation for you is do what you can to increase the foods that fight off inflammation and decrease the foods that we know can make inflammation a lot more worse and make it more difficult for you as well. And if you can do this, this will help out with a lot of the issues that you're having as well. Because for a lot of my patients, they don't realize that these are some of the triggers for some of their gut issues for what is going on in their body and why they're feeling so bad as well. So that's our deep dive for today. Now let's go into a couple of questions that people may have had as well. Let me check on here. If you haven't already, if you're watching on the live stream, don't forget to smash that like button, like, share, and subscribe. Let me know if you're watching this live or on the replay, and also let me know where you guys are watching this at as well. All right, question. Hey, Dr. Islam, I have diarrhea. What are some causes, and what can I do about that? So, how many of you guys, let me know. I know maybe I can't see you guys if you're on the podcast or watching, but if you're in the live stream, let me know in the comments how many of you guys have actually suffered from diarrhea, because it is a common problem that people have, and it's sometimes so difficult for our patients to manage this and get this taken care of. Well, let me give you some of the more common causes for diarrhea. I'll give you 5 common causes. So cause number 1, infections. This is probably the most common cause for people to have acute diarrhea. Whether you get an infection for eating certain foods, whether it's an infection like that's called C. difficile, which is a very chronic bacterial infection, whether it's a virus like a gastroenteritis that can cause an infection. These are very common causes to have diarrhea, is having some sort of infection like that. Number 2 are medication side effects. It is just incredible how many medications, if you take a look, have a GI side effect. And one of the more common ones is diarrhea. So things like metformin can cause diarrhea. Things like angiotensin receptor blockers, so losartan, these can cause diarrhea. And there's so many medications that we know are causes for diarrhea. So just kind of keep that in mind. Even taking antibiotics itself can also be a cause for diarrhea as well. And so just keep in mind, if you're having acute diarrhea or having issues, medications is another reason. Reason number 2. Number 3, if you're traveling someplace, you can develop what's called traveler's diarrhea. This can happen both domestically, but especially if you go internationally as well. You can pick up something by eating certain foods, or having bad water, or just by traveling, where you can pick something up that can cause diarrhea to occur. So traveler's diarrhea is the third cause why you can have diarrhea as well. Number 4, certainly food sensitivities or food intolerances. The most common ones being gluten or FODMAPs or even dairy. So I did not realize later on in my life that I was lactose intolerant. So I kept it going throughout my day, having milk with my coffee, like, it's not a big deal, I'm fine. Then all of a sudden, I started to have gut issues. I'm like, what the heck is going on? Why am I having bloating? Why am I having diarrhea? What is going on? And I came to realize that I actually am developing a food intolerance to dairy. And that's actually it. And so having a food intolerance like dairy can very commonly be a reason to have diarrhea. And then lastly, don't forget, you can actually have a digestive condition that can cause diarrhea. The things like IBS, bile acid diarrhea, pancreatic insufficiency, Crohn's disease, ulcerative colitis. These are reasons why you can have diarrhea as well. These are reasons why you can have loose stools. Now, if you're worried about this side effect, let me give you some tips that I'm going to recommend of when you need to see a healthcare provider, because most of the time, diarrhea will go away. So number 1, if the diarrhea doesn't go away, come see us so we can find out what is going on, because there may be something more than the traditional diarrhea. Number 2, if the diarrhea ever wakes you up in the middle of the night. So no matter how bad your IBS is, it should never, ever wake you up in the middle of the night. So if you're having nocturnal stooling, come to see us. Number 3, if you have significant weight loss. Weight loss is not normal, especially if you've had diarrhea with that. That could be a sign of something bad going on inside your colon. So make sure you get that taken care of. Number 4, if you have severe abdominal pain. So having pain with diarrhea is not normal. If that pain becomes severe or doesn't get better, that's something that needs to be investigated. It is normal to have some cramping. That's not a big deal. But if you are having pain with that, that certainly is a problem. And then lastly, certainly having blood in your stool. Do not ignore that. Do not think that is normal. Do not just overlook that. Having blood in the stool is not normal. So if you have any of these 5 things, come see us so we can find out what's going on and hopefully do a good workup to make sure everything's doing okay and make sure we're not missing anything obvious on that. So that is kind of the workup that you need to do when it comes to diarrhea. All right. Perfect. All right, let me see. Next question here. It's a great one. Hey, Dr. Islam, I just had my colonoscopy done and I was told I have a polyp. How do I know if I have a polyp? I love this question because this goes into the root reason of why we do a colonoscopy. So a colonoscopy is a test for us to take a look, define these precancerous polyps, and remove them before they become cancer. And so the question then becomes, how can we know, or is there a way for us to know if you have a polyp? So let me just straight up tell you, in most cases, polyps are asymptomatic. And that's the scary thing about colon cancer, is that you have a precancerous lesion, which typically doesn't cause symptoms until it's too late or until it's too big. And so there's an excellent chance that you right there watching could be having a polyp, especially if you're over 45, you don't even realize it. However, there are 5 symptoms and signs that can be a sign of a polyp, that if you have these, you need to get investigated to find out exactly what's going on. So symptom number 1 is blood in the stool. So a polyp can bleed. And a polyp that bleeds will show up as blood in the stool, will show up as anemia, or will show up as a positive stool testing for blood. And this could be a sign that a polyp is growing inside your colon that needs to be removed. Number 2 is actually having rectal bleeding. So having blood in your stool that you see. Now, if you see blood in your stool, there's a chance that that could be from a polyp in your rectum. In fact, I have diagnosed plenty of patients in their 30s from rectal bleeding, from having that symptom, and them actually having a precancerous polyp, meaning that polyp, if they would have ignored it, would have gone on to cancer. So it ended up being a blessing in disguise, having that symptomatology of the rectal bleeding. Number 3, having fatigue. So fatigue could be a sign of anemia, which could be a sign of a big polyp that is bleeding. So if you're feeling fatigued, you don't understand why, come see us. We can find out if you have a polyp or not. Number 4, having a change in bowel habits. A big polyp can block your stool, or even big polyps can sometimes cause irritation in your gut microbiome to cause diarrhea. So if you're having a new change in your bowel habits, this could be a reason why is having that polyp that's there. And then lastly, having abdominal pain. Having pain in your abdomen can also be a sign of a polyp. So in summary, the vast majority of polyps don't cause symptoms. This is why you need to get your colonoscopy no later than the age of 45. But if you have some of these other symptoms, come see us. We can find out exactly what is going on. Hopefully make sure that everything is doing okay with respect to that. If you haven't got your colonoscopy, guys, and you're over 45, you need to get that done ASAP. All right. Next question. Oh, it's a great one. Hey, Dr. Islam, I just read a study about some of the more common symptoms of colon cancer in young individuals. Can you elaborate on this? All right. So as you may have seen just on social media, we're seeing more and more young individuals developing colon cancer. Obviously, the person who kind of represented this, unfortunately, was Chadwick Boseman, who in his early 40s developed stage 4 colon cancer. And in my own practice, I am unfortunately seeing more and more younger individuals have colon polyps and colon cancer. So we have some studies out that have come out that kind of gave us a better idea of what are some of the more common symptoms of that. And let me tell you about a couple of them. So number 1 of the more common symptoms are something that you probably know, which is rectal bleeding. And so too many people, unfortunately, just blow off rectal bleeding. And they assume that just because, hey, I'm young, not a big deal, maybe just some hemorrhoids, they just don't, worry about it. But out of all the symptoms that typically can be a sign of colon cancer, rectal bleeding is one of the more common ones that can be there. In fact, 45% of individuals with early onset colon cancer had some sort of rectal bleeding. That's crazy, but yes, this is one of the more common symptoms in somebody who is young. And number 2 can also be a change in your bowel habits. So a new change in your bowel habits, even when you're young, can be a sign of colon cancer, because that cancer or something growing in your colon can change the trajectory of how your stools go. Symptom number 3 is unexplained abdominal pain. So abdominal pain that you don't understand what is going on can also be a sign of colon cancer. Now, keep in mind, these 3 symptoms, even though they're the most common symptoms of colon cancer, it's not only due to colon cancer that you have these symptoms. So if you're worried about what's going on, your body and your gut is like the check engine light for everything else that's going on. It's giving you signs and symptoms of something that's going on. And so if you're having these issues or symptoms, come see us where we can find out exactly what is going on and hopefully get a better idea of what we can do to get that taken care of for you as well. All right. Let's see any more questions here. Ah, perfect. This is a great one here. Perfect. So, hey, Dr. Islam, I've been diagnosed with IBS. What are some home remedies that I recommend to help control this? I love this. So I've treated thousands of patients with IBS, and I am of the opinion that if there's some natural options that we can do to get your IBS taken care of, I'm going to do that. So I'm going to share maybe about 8 tips that I recommend to help control your IBS symptoms. All right, tip number 1, avoid high FODMAP foods. So FODMAPs are certain carbohydrates and starches that are known to cause gut issues, bloating, pain, distension, nausea. And so just avoiding some of these foods will get you feeling better. And this is why when patients avoid gluten, they feel so much better, because gluten is considered a high FODMAP. Other things include things like pears, apples, broccoli, Brussels sprouts, dairy. So there's a lot of lists that are out there. The one that I recommend is called the Monash app, Monash. There's an app that's on there. They also have a website. They probably are the most comprehensive when it comes to giving you the best options when it comes to avoiding FODMAPs. Tip number 2, eat more fiber. Fiber is a foundation for gut health. You want soluble fiber. The best fiber that's out there is one called psyllium. This is the fiber that you want to incorporate when it comes to your IBS. And the more fiber that you have, the best thing that you can do to help out when it comes to your gut issues. Tip number 3, exercise regularly. Exercise is good for your health, it's good for your brain, and it's good for your gut. It helps to regulate what's going on inside your body, helps to manage some of the symptoms, and then gets you feeling better as well. It is free too. It's crazy, but use this to hopefully help out when it comes to your gut issues. Tip number 4, limit dairy products. You'd be surprised how many individuals don't realize that dairy is a trigger for their IBS. And so avoid or eliminate dairy. These include things like ice cream, cheese, milk products, because these are the particular foods that are known to cause gut issues. Tip number 5, avoid artificial sweeteners. Yes, the exact same thing when it comes to dairy. Artificial sweeteners are sometimes things that you cannot digest well, can cause a lot of bloating and distension, and cause diarrhea to occur. So try to minimize or eliminate artificial sweeteners. Tip number 6, try to manage your stress. Stress is real, and there is a connection between the brain and the gut. The more stressed you are up here, the more it's going to manifest in gut issues down below. The more you're having gut issues down below, the more it's going to manifest up here. So find ways to try to manage your stress to get that taken care of. I will tell you, it's going to make a huge difference in your life and how you're feeling as well. Tip number 7, and prioritize sleep. Studies have shown that the poor sleep quality that you have, the worse your IBS symptoms are going to be. And vice versa as well. If we can improve the quality of your sleep, it tends to improve how your IBS symptoms are doing as well. So try to find ways to prioritize sleep. And then lastly, try out peppermint oil. There are studies after studies suggest that peppermint oil can help out when it comes to bloating, distension, and gas. It's the menthol and the oils that can help out, which has been shown to get your gut taken care of. These are the tips that I recommend when it comes to controlling your IBS naturally. And if it doesn't work, come see us up at Gastro. We can find out what's going on and hopefully get you taken care of. All right, guys, a couple other questions out of here. So Nancy S. says, I take Clearax and Citrusol every night. My gastro doctor says it's fine. What do I think? Absolutely. So Clearax is like Miralax. Very safe. You can use this long term. And Citrusol is also fiber, which is very effective. Helps out when it comes to gut issues. I like Citrusol myself because it's not synthetic. It is synthetic. I apologize. Which means that you don't have a lot of bloating, a lot of distension. A lot of my patients feel good as well. So another question, Christina asks, what can I do for urgency? Very good question. So the first thing you want to do is find out why. Why are you having the urgency to go? Is it a bowel problem? Is it a rectum problem? Is it a GI condition like IBS? Is it a muscle problem? Do you have a change in your gut microbiome? So I want to find out the root cause of why you have urgency. And then number 2, Once I figure out the root cause, then we can figure out what we can do. So in terms of finding out the root cause, I may do blood testing or stool testing to see if there's any inflammatory markers that are high. I may take a look with a colonoscopy to see if there's any colitis going on inside your colon. We may do a test to see how well the muscles of the rectum are working to get that controlled. And then sometimes, depending on the cause, we can treat it as well. So things that we can do naturally to help out with urgency include things like avoiding dairy. Dairy is a very common trigger when it comes to bloating and urgency. Number 2, avoiding artificial sweeteners. Once again, it's a trigger when it comes to bloating. Number 3, adding a probiotic into your diet. Number 4, adding a fiber to bulk up those stools. And then number 5, look at your medications. Are you taking medication that is known to cause urgency? Is it like metformin? Is it a blood pressure medication? Is it an antibiotic? These are things that we typically try to look for to delve down into the root cause of why you're having the urgency as well. All right, perfect. All right, I'm proud. I think we did a good show today. We went through a lot of questions. We did a deep dive. If you like what you see, if you like what you hear, don't forget to give us a 5-star rating. Like us on our YouTube page, our Facebook page, our Instagram page, and LinkedIn. Come see Celtic Gastro for all your GI needs. If you're having issues, I look forward to seeing you guys. Tune in next week when we'll do a deep dive on another topic. Guys, let me know if there's something you want me to talk about. But I look forward to seeing you guys and hearing from you guys on future videos as well. Take care.